think where problems happen is people start to feel better with daily activity and function, or even with their strength program, and then they think, "Wait, I'm good. I'm going to go for it full force," without the volume management and the load management to get back into it.
Hello, friends. Thank you for tuning into this week's episode of the Mayn Idea podcast, where today I have the pleasure of sitting down with Dr. Drew Courtney. A few bits of housekeeping. For those that are subscribers to the email list on the website, check your inbox because the rash guards are up and available for pre-order. For those that are not, you can go to the website, www.maynideapodcast.com, and check them out under the store link. As soon as these sell out, they will be pulled off of the site. But you can check out both the long sleeve and the short sleeve rash guard to support the show. I'm so hyped on these. They came from collaboration with my friends over at Perry Athletics, the best in manufacturing of rash guards. So grab them before they're gone. The other way that you can support the show is by leaving a 5-star review on Spotify. It's so easy to do. It only takes 30 seconds, and it helps tremendously with organic show growth by placing the show in front of other people that enjoy strength and conditioning, human performance, and jiu-jitsu. Today, I sit down with Drew Courtney. He's a doctor of physical therapy and certified athletic trainer. He's also the co-owner of DBC Fitness in Carlsbad, California. I have been stoked to have Drew on the podcast because I owe everything to him with regards to my cervical spine injury that landed me in the hospital back in February. He took me in, diagnosed me, came up with an awesome exercise prescription, helped manage my timeline, and really gave me the belief that I could get back to the sport that I love so much and all the other activities, jiu-jitsu, surfing, and the rest. It was really through his expertise that this was possible. When you get injured, it can be a really dark place, and you start to spiral when you think about all the things that you're going to miss out on. Being able to place that stress in the hands of a professional who's seen this stuff happen before really gave me the peace of mind. And ultimately, it gave me the track back to now being able to go full clip in jiu-jitsu, which back in February, I honestly didn't know if that was ever going to be a possibility again. So I'm stoked to have him on the show. He has a wealth of knowledge. And if you want to get in contact with him, check out the show notes. To support the show, you can check out the sponsors and the links below. And ladies and gentlemen, without further ado, the man, Dr. Drew Courtney. Well, Drew, I'm so psyched to have you on the podcast. You are the guy that put Humpty Dumpty back together again after I ended up in the hospital in February, which I'm sure we'll talk about on here. But I know you're a busy man and you spend a lot of time helping people get back to the sports they love. So I really appreciate you taking the time to be on the show.
Yeah, thanks, Abe. This is something we've talked about for a while, and glad the timing worked out and we can get to it.
So there'll be an intro that precedes you, as with all episodes, but I wanted to give you a second to, and I think this is fun with humble people like yourself, because in it lies a challenge, but to really speak on what makes you an expert when it comes to rehabilitation, to return to sport, injury diagnostics, and really approaching the body from a movement standpoint and helping people return to the things that they do. And you can really, feel free to gloat as much as you want here, just to give the listeners a piece of your background and what led you to really pursue and love this as a career.
Yeah, for me, I've always been more of a listener than a speaker or a talker. And so I think that's part of what has helped me develop my skills and expertise, is just being around great practitioners, great trainers, great coaches, and observing and listening. And I've been able to learn a lot from great individuals throughout my career so far. And then another piece of it is just the experience that I've had. I've been fortunate enough to work with a wide variety of individuals, athletes from youth to high level professional, and then also a wide range of general population individuals. And the human body is the human body. And so having experience with many different types of people has allowed me to pull from my previous clientele to gain experience with everyone that walks in the door.
So that's an important part here is this: the human body is the human body. I love that you said that, because over the years as a coach, I've gone back and forth, I think, on my stance of how important it is to have your trainer, your massage therapist, your physical therapist do the things that you like to do. And I think the most crystal clear example of that not being true was how fortunate I was to work with you when Casey introduced us, in that I trained jujitsu, 3 to 4 days a week, and it's a huge part of my life. You don't train jujitsu at all. And that was, in the beginning in my head, just doing the math, I'm like, well, this is really problematic because this guy doesn't understand what I do. Right. And I think a lot of people hold that belief when they approach physical therapy and rehabilitation for injury. Can you speak on that a little bit about, how much a true understanding of the body really transcends different sports, different disciplines, and different levels of stress, and how someone like yourself, and this is in the proof, was able to approach a sport that was nuanced and develop a plan, diagnose correctly, and then ultimately, return me to sport to a level where I'm coming off of a, C6, C7 herniation and nerve pain, and now I'm 100% not dealing with any of that.
Yeah. So, like we touched on before, like the basic movements, mechanics, function of the human body is standard regardless of sport. Now, there does become nuances when we start talking about different sports. And I think having an experience in that sport is helpful, just for obvious reasons. Um, but it's not a requirement when you're working with a variety of individuals. Something for me was talking to experts in the field in jiu-jitsu in the field, like Casey and some of the other coaches, and discussing and having conversations that open my eyes to different things that then I can tie that with my knowledge of the human body to create a plan moving forward. And so you don't have to be an expert in the sport to still get great results, but you may need to do some extra work outside of it to understand the demands of the sport and then combine that with the
Right.
previous knowledge of the human body for my case.
When you're looking at a new sport, when you're, dealing with a client whose injury originates in a place where you're not super familiar with, how do you walk that line between, you know, being knowledgeable in your specific skill set and understanding the body, and not like faking it till you make it in regards to knowledge of the sport and the demands? Because I know that I face this in some regard with training, when a client would be, for example, they're running a marathon or they're doing an Ironman, and I can speak to that because I have friends and family and stuff that have completed those, but those aren't feats that I've accomplished myself. And it's a challenge when you're trying to speak that language and you want to give them the, what each and every client deserves. How do you navigate that?
Yeah. So, that's a great question. And I would be curious to get your take and opinion on it as well with how I navigated it with you. But from my perspective, it's being honest with the client in front of me. And if I don't have the knowledge on the sport, asking questions to understand it better. And so it may take me asking specific questions or just having the client speak to what the sport is like, what kind of movements they get in, what positions they're put in, etc. So I can understand better. I've have experience working with dancers as well, ballet dancers, and I never did that. I don't have family members that did that, but just by asking questions and listening to them, I've been able to understand, okay, the positions that they have difficulty in or the movements that they're trying to do. And I feel like you and I had a lot of conversations at the beginning of, oh,
Yeah.
what's problematic? Where do you feel vulnerable? What are you going to be doing in your session today, etc. And that helped me understand. So I guess from your perspective, what did that feel like for you? And I guess, did it give you any concern, like, oh, this guy doesn't know about the sport?
I had zero concerns that you were the guy for the job. And that partly comes from my teammate Casey, who has an extensive fight background, far greater than one I'll ever be able to achieve with his experience in Muay Thai. And I think he just understands from a high level coaching, strength and conditioning, but also he does the sports, right? And he's actually on the mats. And so he feels the aches and the pains and the tight hips and the hamstrings and this and that. And so when he recommended you, I knew that there would be some things for us to figure out, but I was kind of open to that, I think, in the first place. But then in addition to that, I knew that you're a humble enough person and a professional, and I put myself in the same kind of basket when I work with people, that if you didn't know something, I knew you weren't going to try to bullshit me about it. And Casey's right there, and George is right there, and other people that are there that do it. And so it's just a turn of the head to pitch an idea or bounce a question off them. But I think that also, when I look at, and I think over the years, I've really come to the conclusion that a good strength and conditioning program has physical therapy as a component. It's not when something goes wrong, go to the mechanic. It's like we just take the car in every once in a while and get it checked on. And the reason I think that's so important is because you were able to give me, by and large, the most valuable piece of the whole thing, which was expectation management. You understand the joints and the tendons and the ligaments at a level that I never will. And I won't pursue that knowledge because it doesn't serve me in what I do. But because of your knowledge there, you could help me understand this is probably what you're looking at in terms of return to sport, which was the most important thing to me. Without you there, I don't know what that timeline looks like. And what I've seen in, hundreds of cases at this time is that people's brains heal a lot faster than their tendons and ligaments do. So they hit that sweet spot where they're like, oh, I feel good. I think I could go back. And they go and they get re-injured. And so that conversation with you was like, I don't know if I could put a value on that because it kept my head in the right spot. And that's a really hard part as an athlete when you get hurt, is that you just spiral, man.
Yeah, it's
into like the worst place.
100%. It's easy to, when something goes wrong, or you're like, oh, I feel great, I get back to it, and then something happened, a bump in the road, if you will, and you're like, oh, here we go again, back to stage one. I'm falling behind. This isn't going to get better. It's so easy to get into that headspace. And I like to remind clients or patients, like, you're dealing with this every single day. And so it's hard to take a step back and to realize the progress that you made and where you're going and what you've already accomplished thus far. It's a huge challenge. But then to touch on your other point with expectations, I think where problems happen is people start to feel better with daily activity and function, or even with their strength program, and then they think, sweet, I'm good, I'm going to go for it full force, without the volume management and the load management to get back into it. And it's something that, I mean, we talked about it every week. It's like, okay, how'd you feel with that percentage of volume, that intensity, that time? Okay, X, Y, or Z is the result. Here's how we're going to adjust for the next week or two. And it has to be, I think you have to have a really good strength coach or a really good physical therapist to have that narrative. So you're progressing appropriately without falling backwards, but also keeping you interested where you're not getting bored just doing the same thing every week.
What are, in terms of, maybe there's like baseline generalities here, but for like ACL, cervical issue, rotator cuff, Achilles, just trying to think of other like really common things you would find, definitely in jiu-jitsu, but I would imagine most sports. Are there like general prescription timelines that the tendons and ligaments have to go through with progressive loading to be able to even get back to the sports that you like to do? And then the variance is like in the individual, or how do you look at those kind of general return to sports per joint or per injury that someone suffered?
Yeah, I would say, I mean, it's nuanced. It does vary depending on the individual, obviously, but there are generalities when we're talking ACL injury with the reconstruction, cervical disc injury, or even lumbar disc injury, Achilles injury. Like, there are generalities to understand and know when how long certain type of tissues heal and the time frame on that.
Mm-hmm.
But then you have to pair the generality with the individual in front of you. How is their overall health? Are they doing everything they can to improve and progress healing? Are they not healthy? How is their strength development? What was their activity level before? I mean, there's a lot of factors that go into it. But yeah, we have
Yeah.
some generalities that we take into consideration. And I like to talk about those, but then I like to tell people our goal is to not slow down the healing process. I think it's a hot topic right now in the industry and in health to try and increase healing. And the body heals at its normal rate. We don't want to get in the way and slow down it. So we want the body to just heal at its normal pace without doing things to hinder that process.
So maybe you can speak a little bit about this component to that, because I would agree. I think in the face of just recovery is such a like a hot point in strength and conditioning. You can look at how many millions of dollars have been invested into this industry in percussive therapy, compression therapy, cold plunge, sauna, like all these things that, to be fair, have been around forever. You know, cold exposure didn't show up last year. It just showed up on the right podcast last year. But people have been using cold exposure for eons, and you could really look to any modality and probably draw a much further line back in time than the super marketed in your face, can't get away from it on Instagram focus. So a lot of this is, I think, kind of the way that CrossFit introduced itself into the fitness industry. Ultimately, it's a net positive because now you have people talking about recovery and they weren't before. That's good. The way in which you do that, I guess, could be argued. But with CrossFit too, bumper plates and barbells weren't common in corporate gym settings before that, or most boutique studios. So it comes in, people get hurt all the time doing it, but the net win is that people look at functional fitness now, and I don't think they were really doing that before. So these two things in the industry have had a big impact in different ways, but it is important to look at things that haven't changed over that time, which is the body's healing process, right? And that varies to the degree to which the individual is already healthy. And I'd like to hear your perspective on that, because I look at, this recovery, ending up in the hospital for a neck thing, that's like not in my playbook. I don't go to the ER for the place I stay the absolute furthest away from possible in life is the emergency room, let alone one where they're going to just prescribe you a bunch of drugs immediately and send you on your way. So to be there was weird. But I also had the confidence that up until that injury, I had prepared my body, I had trained, I had done that intelligently. I've worked recovery and all this stuff. So I knew that to recover, I was in the best position that I could be physiologically. And it was still longer than I wanted in my heart, but still short relative to how big it could have been. So when you look at individuals, how much does something like pre-existing activity routines, as far away from sedentary as you can be, how does that impact that? And then how does that change when you start to look at the activity level of athletes versus general population, or general population versus an aging population?
Yeah, I think it plays a huge role in healing time after an injury. I mean, we talk about it's common to talk about prehab for individuals before surgery, and I
Mhm.
think that emphasizes the point that you just made is like what you do before surgery sets you up to have success after. And so living a continuous and consistent healthy lifestyle without the expectation of, oh, I'm going to be hurt at some point. Just doing it sets you up for recovery after an injury, if whenever it does occur, which a lot of us do get injured because we're trying hard things and we're pushing ourselves. So
Right.
when an injury occurs, all the stuff that we did beforehand to maintain and live a healthy lifestyle is setting us up for recovery afterwards. And so that is important for your general population. You have to be able to be healthy to work, provide for your family, do all those things. So it's just as important for them as it is for a high level athlete. And high level athletes, they may not be living a healthy lifestyle. Some of them are, some of them are not. that
Yeah.
still does affect their healing time afterwards. Same that we see with general population. Some are living healthy, some are not. And then when we start getting into the older aging population, I would argue it might be even more important for them to be living a healthy lifestyle prior to a dysfunction, pain, injury, because now you're talking about life or death. Like if they have
Right.
a injury that affects mobility, that could be a death. I mean, they could go to an assisted living facility and quickly decline after that. And so
Right.
the emphasis on living a healthy lifestyle day in and day out has to be there for everyone.
How does this change when you look at, yes, I'm just mumbling here, but what I what I'm trying to get at is that within this scope of activity level, let's take a jiu-jitsu practitioner, for example. So we can both agree that if you're going to go get surgery, or if you're going to go and tear your ACL, which no one would intend to do, having degrees of strength and conditioning and wellness and activity baked into your weekly routine would be ideal, in that it sets you up, on from a cellular level to a peripheral level, readiness and ability to recover from that and get back to homeostasis. But I think sometimes people equate activity at all with like readiness or wellness. So if someone goes to jiu-jitsu twice a week, maybe they're listening in their head and going, okay, well, I'm active, right? I'm doing jiu-jitsu twice a week, so that's sufficient. Or I'm doing, let's say I'm doing jiu-jitsu 4 days a week, but that's all they're doing. So it's just whatever their lifestyle is, maybe a little walking here or there, and then 4 days of jiu-jitsu. In my head, that 4 days of jiu-jitsu doesn't really count towards this preparedness, because the sport itself is extremely risky and uncertain. And so there's going to be huge glaring areas of weakness, instability, and dynamic changes in position that, unless you're actually training for that activity, you're not really ready for. So those, the runner who just runs 5 days a week and does no ankle stability, no quad tendon strengthening, no hamstring and glute activation or something like that, and they just run, they're actually almost hindering themselves, because they're setting themselves up for injury. So what are your thoughts on that? Like, how does this gradient scale between those that are doing stuff and those that are preparing for stuff?
Right. I think it's a great point. I'm glad you brought that up. I'd be curious to know from your perspective. I mean, as a coach, how are you having these conversations with your clients as well? But I think we need to talk to our clients, or people need to ask themselves, the activity I'm doing, is it a sport, or am I just doing it for general fitness? I guess, like, so what I mean by that is, like, if I'm going to the gym, I'm doing weight training, that's not a sport. I need to add other physical activities to create overall health. But if I'm going surfing, to me, that's a sport. Maybe it's not at a competitive level. Yeah, it's going to help with my overall fitness, but I need to be doing things to prepare my body for that sport. In jiu-jitsu, I consider a sport as well. Running, I would even consider a sport. Like, you need to do things to prepare for that. And so we can't just be dominant in one activity. We need to be doing things to make sure our body's ready for that activity when it's spun in a way that's more sport like, rather than just
Right.
general exercise in the gym. So
Yeah, I'm always
how do you
go ahead. Go ahead.
what's your conversation like with your clients when you have them come in?
I think in a nutshell, like, this is my entire ethos. My entire ethos as a coach, and it's really developed over my 10 years coaching, but also my lifetime as an athlete, is like, my whole thing with clients is I want them to be able to say yes to anything that life throws their way. So if a relative reaches out and says, "Hey, I'm going to go do these 14,000-foot mountains in Colorado and prepare. You do want to go do that?" I want my clients to be able to say yes. If your best friend texts you and says, "Hey, do you want to do the Carlsbad 5,000?" I want them to be able to say yes. And the difference between being able to say yes and being able to say no is, are you actively pursuing a more capable version of yourself? And that can be varied in degree. It doesn't mean that you have to want to set the pace record on that, but is your body in a condition that it can go and do something? You can extend yourself beyond your current level with minimal effort, do that thing, and then come back to where you are. Whereas if you're off the couch, doing the Carlsbad 5000 could be a year-long endeavor, right? Because you have to get to walking, you need to get your body into the right position, you have to recover properly and understand that whole relationship, and then how sleep and food impact that. So it's like a bigger order for someone that's further away from activity. So I look at everything through that lens, and then scaling that lens to what matters most for the client. And that's a hard thing, I think, as a coach and as a physical therapist, that you learn early on, is that you can't ever want something more than the person that you're helping. And it's easy to get in that moment with someone because you see the potential that maybe they don't see. And so you want it so bad for them, but you kind of have to just meet them where they're at and say, how do we get you to be able to say yes more from where you are right now? And when I look at everything through that lens, things like jujitsu and running especially always surprise me, because there's so much opportunity for you to get hurt. Even though they, like, running seems so simple and jujitsu seems so dynamic, but there's equal opportunity in both to have a big setback that really changes your life. If running is the activity that you choose, you don't prepare your body, and you tear your Achilles, what's that going to do to that person? Are they ever going to run again? Are they ever going to take on a new activity again that's outside of their comfort zone? And because of that potential end, I think it's so important that, to whatever degree it fits in your routine, you adopt some sort of strength and conditioning and preparation. And it can be small. It could be 2 days a week where you're doing, a workout at your house and you're really just focusing on mobility and understanding your body. Or it could be as complex as training 4 days for some sort of competition that coincides with what you do. Right. So I think it's so much why I love coaching, is to help people understand how it's like a in a video game, you're playing like Mortal Kombat or something, and you hit that combo that like supercharges your player. It's very much like that. It's just this X factor that allows you to safely go do things that you love to do.
Yep. And I love it. I completely agree with everything you just said there. And it's something that all of us at DBC value and preach as well. Like, whenever clients or patients come in to see me and they want to improve their performance, I say to them, I'm going to make you a better functioning human, which will then translate to your sport. And that's priority. We need to make you better at just being a human. I'm not going to improve the skills of the sport. That's what you do with your individual practice. I can make you function better as a human, which will naturally carry over to your sport. And it's exactly what you just said. If you're a better functioning human, great. That's your cardiovascular health. That's your strength. That's your power. That's everything. So then you can go and be like, yeah, I want to run a Carlsbad 5K. I want to hike a 14er. I want to compete in a 3-on-3 basketball tournament, whatever it is. When you're a high functioning human, you're ready to go and do it. And so I think it makes the conversation easy with clients when that's your goal and everyone's on board with that.
Maybe we can talk a little bit about some specifics here with regards to injuries that you see a lot. And we can kind of look at, just because you're proximal to, you're in North County, San Diego. So we got a lot of surfers, a lot of runners, mountain bikers, some hiking, although as a Coloradoan, I can argue that it's really subpar.
Nature walking, not hiking, but
yeah, on a fire road. All things water sports, kayaking, canoeing, stand-up paddle, everything, right? So you're seeing a lot of people that they're active across multiple planes of motion with varying degrees of conditioning requirements. Then you have, the martial arts community is just booming in SoCal. It's maybe the highest concentration of jiu-jitsu maybe with the exception of Austin, which is new, and then there's some spots on the East Coast, but you really have a cool basket of activities that people take on. And then there's all the winter sports too. I mean, people are happy to commute, myself included, several hours to go to Mammoth, to Big Bear, to Tahoe, and they do it all winter long. So when you're looking at all these different sports, I know in jiu-jitsu, knee injury is the most common. So you get a lot of uh, injury caused by excessive rotation, hyperextension, flexion past the degree to which the person trains, and a lot of acute and quick movements that result in injury. So if we can maybe kind of go through these, I picked out a couple: cervical, obviously, because we can talk about the whole process that I went through, ACL, and then I'll kind of rattle them off as we get to them. But what can someone expect if they suffer, an ACL or a knee tweak? And maybe we can approach this from, they haven't seen you yet and they're in that like freak out mode. It's new. What are the steps that someone should take? And I'd like to include in that the fact that disposable income isn't available to everyone. And I think that that's a disparaging factor, but something worth addressing, because not everyone will be able to find a high level facility like the one that you operate out of, or B, have the financial access to make that a reality. So how can they start to work through this when they suffer a knee injury?
Yeah, I love it. So I think the first thing when you have an injury is, I mean, we've touched on it, but it's make sure the general health things are in line. So right after the injury, the initial thing we want to do is decrease the excessive inflammation that's happening. So we want to make sure you're eating well and you're hydrating a lot, probably more than what you normally are, to let the body go through the normal healing process. And yes, there's going to be inflammation that occurs, and there should be. And so that's the body's response to something bad that happened. And we want to let that occur, but doing all the things to decrease the additional inflammation that we're putting into the body. So we're staying away from sugar, we're going to bed early, we're doing some low level activity to decrease our stress, all these things to decrease overall whole body inflammation to let the injured site recover and begin the healing process. After that, we need to, if we haven't seen a practitioner yet, we need to do a little self-assessment. Did we hear a pop? Did we feel a pop? Do we lack instability? Can you contract the muscles around the knee? So can you get a good, strong contraction of the quad, of the hamstring, of the calf, up into the glute? How does all that feel? And how does it feel compared to the opposite side? From there, depending on your basic knowledge, we may need to go see a practitioner. You may need to go see a physician. You may go straight to a physical therapist or a high-level strength coach, depending on the results that you get in that self-assessment. And we can, if you want to, we can go into more details on that in a bit. But the self-assessment will really, I guess, help determine how serious it is. If you feel like you've lost stability, you don't have the good contraction of the musculature around, I think then it's time to go see someone and get a further evaluation. Maybe you need to get an x-ray or an MRI to really figure out what's wrong, or go see a practitioner and they can tell you, yeah, we need to get an image of this. That's the initial stages of it, right when it occurs. And then from there, we let the inflammation settle for 3, 4, 5 days initially. And then we see, okay, is it improving? Is it getting worse? Is it staying the same? If we get a little bit of improvement, it's not going to go back to 100% that quick, but a little bit improvement is a huge positive. We want to start to increase the range of motion, not by pushing through pain or cranking on it, but getting the joint moving again. Getting the joint moving and contracting the musculature are two of the best things we can do to decrease the swelling in the joint. So I always tell
Interesting.
people the three things to do for your inflammation is compression, elevation, and then movement, which is activation of the musculature around the joint, and then active or passive movement of the joint. All that does, well, what that does is activate the lymphatic system and helps push the fluid out of the injured area to get dissolved and removed from the body.
So that's a little contradictory to what most people have probably heard, which is the old Rice approach, the rest, ice, compress, elevate, right? So what is this shift, which I felt has really happened the more I got exposed to high level practitioners like yourself who really understand the body and how to rehab it? Why the movement away from ice when you immediately create the injury or you experience that trauma?
because because of what occurs with basic movement and at the physiological level, we see the swelling start to dissipate, and we see the ability to maintain the muscle contraction and the activation around the injured area. I mean, you can test yourself. Go sit in a cold plunge or put an ice pack on your knee. Stand up. It's
Yeah.
hard.
Try to
Yeah,
move.
try to contract your muscle. It's hard to move. You can feel the difference. Does it do a great job of taking the pain away? Absolutely. And if you're using it for that, I'm okay with it. Is it going to decrease your swelling and inflammation? No. And this was something I learned 8, 10 years ago now, back when I was in my undergraduate program. My mentor and professor did many studies on this, and he actually would. One of the studies was he would take a tennis, like a machine that shoots out tennis balls, and shoot people in the leg with the tennis ball, and then have them put ice on the leg and look at healing
Yeah.
and swelling, and then do it again on someone and not have them ice and look at the differences.
Yeah.
And the results were much different. And so it doesn't mean, okay, you injured your ankle or you injured your knee, you get right back into the sport, because obviously the demands are much different. And so you're not ready for that.
Right.
But we want to maintain the low level things of basic movement and activation.
So you mentioned, I feel like most people, they put compression and ice together. That's often done with like a bag of crushed ice and saran wrap or some sort of compression device that you can buy online now where it's a cold pack, but it's malleable. And so you can wrap it around. So if you're doing compression in the absence of ice, how do you want clients to do that if they don't have, let's say they don't have like a Normatec type attachment? Like what's a good way to compress a joint without ice on it?
Yeah. Well, back to your previous point of like the compression with like the saran wrap, I don't know that that's actually getting enough compression to make a difference from the compress, like just the compressive standpoint. Now, if we talk about
Mhm.
like Game Ready or some of the other devices that are actually compressing, I think that's different.
Yeah.
But just
Okay.
at home, I think I always recommend a compression sock. You want it to
Yep.
go above the joint. So if it's the knee, it's the long sock. It goes all the way up
Yep.
above the knee to the middle of the thigh, if possible. I think that's something that's easy for people to do at home. An ace bandage is another easy one for people to do. When you, with that, start distal, so start further down the joint and work your way up. So you're going from like mid calf, knee, for example, mid calf to mid thigh. That's another easy compressive tool that you can get from Walgreens or something for cheap. And then elevation is also a super easy one. It's free. Put your feet vertical up the wall
Yep.
and let gravity do the work for you. People,
So if I'm
go ahead.
kind of unpacking this in my head, like with the knee, so the knee experiences trauma, and as the individual, you're trying to discern, is this something that warrants going to get an MRI and like going down that potential surgery or rehab route, or is this something where like it was a bad tweak, you don't know because you go to put weight on it and it feels weird, so you don't want to make things worse. The compression does it squeeze the fascial tissue closer to the muscle? And then the elevation it obviously changes the flow of blood a little bit as it goes towards the joint because of where your heart is. So it's pulling some of the otherwise natural swelling that would happen out of there. And then that begins to, what is that
Yep.
doing to the actual joint? Is it like refreshing it, or is it getting more white blood cells to the site? Like, what's actually happening when someone does compression and elevation at the same
So
time?
it removes the damaged or injured or dead cells, if you will, out
Yeah.
of the area, and which is through the
Okay.
lymphatic system. So the lymphatic system is a passive system, and so we want to use external things to move the fluid through it. External things
Gotcha.
are the compression and the elevation, but also how we do it normally. So people may think, well, if it's a passive system, we don't always wear compression. So how does that work? We have our muscles that contract, and so that's the third thing that I mentioned
Mm.
before,
Right. Movement.
movement, and that's the firing, contracting, and relaxing of the muscles. Which that's what naturally, without these external devices, pushes the fluid through the lymphatic system. And so that's what we're trying to do with the
Gotcha.
elevation and the compression. These are passive. You can just sit and relax while you do these, and it pushes the fluid or the damaged cells through the lymphatic system for removal.
So I always think of this like when people ask me what they should do, I always say go go see Drew or go see like a physical therapist first because it's not my scope of practice. But I think of like if a small bomb detonated in a metropolitan area, what would be the initial response? Would you shut down 15 city blocks and just isolate that area and do absolutely nothing? Or does like the fire team show up and the paramedics show up and the police show up and like everything rushes to the site to assess damage, diagnose damage, fix the damage, get the sick people where they need to go, get injured people out of there? And this kind of happens. And I think of joints as kind of the same way. It's like there's been this acute thing that happens around the joint or the muscle. How would you want to respond? You want your body to send everything possible there to fix it. Well, when you shove all these new people into this space, it looks swollen. There's more people and bigger density in the area than there was before. And so that's a really important part of the healing process that I think with all these tools and all these things and ice therapy and everything, it's easy as an individual to get confused on how valuable that part of the process is and how much you want to let it happen. And I just got my wisdom teeth out, and the doctor was funny. He's like, look, I'm going to go in there. I'm going to break your teeth apart and we're going to drill in. It's going to be nasty. And then you're going to have these cuts in your mouth. It's going to feel horrible. He's like, you're going to want to ice your face a lot because it's going to feel swollen. Then you're going to look like a chipmunk. And he goes, ice it but don't ice it anything past the first 12 hours. And he's like, I want your face to be as swollen as possible. We want everything going there, tons of blood, tons of white blood cells going in there to fix the potential for a serious bacterial infection. And when he said it like that, I was like, that makes total sense. And it just gave me like a little bit of peace of mind when my face got all swollen. I knew a process was happening at the site where it went down. And that's such an important part of injury. But it does bring me to the next point on this. So people are not to then just sit at their house for 15 weeks with their knee the size of a watermelon, right? So you have these steps in place, and it's somewhat of a protocol so that someone can arrive at a decision-making point, which is this thing getting better? Is this thing getting worse? So let's say it's not getting better, and they go in, they're able to get an MRI or an X-ray, whatever the doctor recommends, and then the recommendation is physical therapy. Well, the problem is that, and I know this from doing both, the difference between going to you and doing physical therapy with you and going to, let's say, the Kaiser Permanente provided in-network physical therapy experience, wildly different in terms of care, timelines, management, discussion, all that kind of stuff. And I've done both. in the event that someone doesn't have access to go into someone like yourself, who's as versed in activity and sports, who has the peers that you do and the community around you to really understand things that might be more on the fringe of your understanding, how should someone approach this? Should they just blindly follow whatever the physical therapist says? Should they get multiple opinions? Should they bounce that off TikTok videos that they watch? Like, what's the right approach here for someone who's constrained a little bit by the financial weight of this?
Yeah. So I think there's a couple things that people can do, and it's a real problem. And unfortunately, the reality is some people are going to have access to it, and some people aren't. And it's tough. I think we're living in a beautiful time where Instagram and TikTok and YouTube, despite a lot of bad things that are out there, there's a ton of great resources out there for individuals to look at. I mean, you can follow any of the coaches or trainers in our facility. There's other people outside of our facility that post amazing things about this. So number one, I would say like go to those, try to find people that you know or that are promoted or connected to people that you're close with, etc., and gain personal or self knowledge that way. But the other huge piece of it is talk to your practitioner, understand them, understand their knowledge base. Have they worked with someone that has that type of injury? And have they worked with someone to get them back to, I'm going to say, high level sport or high level performance? Mm-hmm. It may not be the specific sport, but we talked about that earlier in the show. If it's not the specific sport, are they doing things to understand your personal needs of that sport? So I think that's a big piece of it, is you need to go in confident to that provider and express your desires, wishes, and needs, and see if they can meet you there. If they don't want to put the effort in to meet you there, then you don't waste your time, because you're not going to be happy with the end result of it. And so it's being an advocate for yourself, whether it's in a performance physical therapy setting or it's at your in-network setting in a hospital. I think there's great providers there. They're not all in performance settings. And so you can find someone in an in-network setting that will take the time with you and will do the work to get you back to the sport. You just need to have that conversation with them up front and be honest. Be like, look, I want to perform at a high level. Can you help me get there?
Yeah, I felt like, having gone to like a Kaiser provider and going to you, one thing that you'll notice right away is that the prescription is very different. When you come out of like a big healthcare provider like that, they're going to have replicatable systems that they use across all their different offerings. So you'll leave most likely with like a PDF printout, some interesting illustrations that were drawn up in the 70s that they still use. That's like how to do, a neck stretch, and a little bit of specification based on what the physical therapist saw with you, but it's relatively general. Mm-hmm. When I went with you, I come out of there with a very specific protocol based on the assessment that you did with me, how I'm feeling that day. And one thing that was really cool is that it was malleable. We'd talk every time that we saw each other. And like most good programs, it functioned as a framework, but it wasn't an absolute design for the house. So we would shift a wall or we'd add a level. There's all the different ways that it was changing as I was changing. And some things progressed faster than others. And so you would make those adjustments, always starting from this baseline assessment, me sitting in the same position with you, looking at the same things, so that unweighted, unloaded, without activity, kind of where are we right now? And when I look at those two options that people might go through, it's important to remember that like a poor program done really, really consistently is more effective than a great program done really inconsistently. Yeah. The ideal situation is what we had: really high level programming and understanding from yourself, and a total addict to like doing things exactly how they're supposed to be done. So it worked really well, because whatever you would tell me to do, I would do exactly that. And then things that stuck out, we would fix. So when people go to those and they do get these generic things, doing something consistently is better than nothing. It's going to move the needle in the right direction. maybe they can couple that with some of the things they find online or from, reputable sources, but it's a hard thing to navigate as an individual.
It is tough, but you're completely right. Like, it's doing something that is appropriate and not hurting you is going to move it in the right direction. It's what we touched on earlier. We want to do the best we can to let the body heal itself and honestly not get in the way of it. The body's an amazing thing. And when we have this specific program, maybe we're getting in the way less, if you will, if you think about it that way. But even if the program's not perfect and designed specifically for you, if you're doing something, you're letting the body heal and progress. And so I completely agree with you. We can't just sit around and wait and do nothing to hope that we're going to get better. We have to at least try, at least do something.
Yeah. So when you look at these different injuries, I kind of like this self-assessment. I would imagine it holds relatively true for most joints, with the exception of, I'm thinking of how you would elevate a compressed neck, but you're already standing. Maybe like I don't know, maybe you could explain that. But you hurt the joint, you give it some time, you watch the swelling, you watch the inflammation. If it's compressible and elevatable, you do that. Then you add some movement to start to get things to flow again and get back to baseline. And if that's not happening, seek professional help. If it is happening, stay on that track until the inflammation goes down and you feel like the range of motion is similar to the other side. But maybe we can talk now about how to eliminate your job, which is how do we take these? Let's take the three biggest in jiu-jitsu, and that would be knee injuries, neck injuries, and spinal injuries. So like lumbar, right? It's probably what people injure most. They tweak their knees, they tweak their back, or they tweak their neck. So what are some things that people can do? Maybe you can go joint by joint here on prehab, like keeping these things healthy, whether you're doing a 5-day week strength program, or you're just a runner, or you just like to surf, you don't like to strength train, but you love doing jiu-jitsu. How should people dedicate time? How much time? And what do these look like so that they can at least position themselves to not get hurt in those preventable situations? Like if you're falling back without a ton of force and you brace, you shouldn't blow your shoulder out. But people do that all the time. So barring some acute thing, how can people best prepare their knees, their neck, and their lumbar?
Yeah. Okay. Yeah. Let's just kind of go through it joint by joint and see what carries over between joints, and then go from there. So I think for the knees, number one would be doing some type of basic foundational movements. So for the lower extremity, it's going to be squat, lunge, and hinge or deadlift. And it does need to be, you don't need to be setting world records or PRs, but you need to be moving in those functional patterns, because that's what happens when you perform a sport and perform life. And so you need to be able to perform some type of squat, whether it's an air squat or a goblet squat, a lunge correctly, and a hinge or a bend correctly. Doing those consistently, what it does is remind the body this is how we move. So then when you get into the sport, if you naturally are pushed back and you have to drop into a squat, you know how to get there without thinking about it. So that would be one of the things. Other thing for the knee would be do some soft tissue, some soft tissue mobilizations around the joint. So foam rolling, it could be a foam roller, tennis ball, lacrosse ball, anything, Theragun, of the tissues surrounding the knee. So the quads, the hamstrings, the calves, and then the glutes. Doing that, and that could be 20 minutes a day if you want to be really consistent, but at least 2 or 3 times a week would be ideal on that. So basically, overview of that, we're getting general movement through the joint with our patterns, general movement, and we're emphasizing proper mechanics. So we kind of get both of those by moving through the patterns. And then number 2, we're taking time to do a little assessment of the joint by doing the soft tissue. How does the joint feel? And then we're
Yes.
self-treating the tight or irritated soft tissue structures around the joint. So
That's
that
something
could
that
be
I like a
30
lot
minutes.
because people,
Yeah.
I hear kind of like our different viewpoints on foam rolling or myofascial release. And one thing that I, no matter what your view on it is a decent assessment tool on the day. And that's an important distinction, is that your body will not always be ready the way you want it to be ready. And sometimes you don't know what parts are not on board. If you foam roll your right glute and your left glute feels like you're sitting on tacks and your right glute feels fine, you know there's a discrepancy. And that discrepancy is not going to go away when you ramp up the intensity of sparring or you ramp up the weight of your opponent. So if you don't address that on the day of, then you're missing out on a big opportunity to mitigate risk.
Yeah, exactly. Is foam rolling going to prevent injury? No, but can it potentially balance us out for an hour or two after we do it? Yeah,
Yep.
I think so. I believe so. And so if you can do that before your sport or activity to at least keep yourself a little more balanced, are we symmetrical beings? No, there's going to be some asymmetries, but if we can work to being a little more symmetrical, I think there's benefit in that to reduce injury risk going into your sport.
Absolutely.
So let's go to the low back. I think some of the things will carry over, like the soft tissue. The glutes are an area that we want to foam roll for the lower back. So you're doing it for the knee, you're getting benefit for the lower back as well. And then the low back musculature, so parallel to the spine, and then just lateral or just outside of that as well, which would be like your quadratus lumborum area.
Mm-hmm.
Those are areas that can get tight and feel a little irritated. So just again, a quick assessment. If you feel some tightness there, show it some love, spend some time on that muscle group. But then activity or strengthening wise for the lumbar spine is teaching the body. This one's huge. Teaching the body how to move through the joints without moving through the spine. And so what I mean by that is
Yeah.
being able to maintain a neutral lumbar spine position while you're moving through the hip joints or even moving through the shoulder joints. And what that does is
Right.
it protects the spinal structure. The spine is, and we'll talk about this when we talk about the neck too, the spine is at its most stable position when we have our normal curvature. And everyone can think back to like middle school science. If you
Right.
look at a skeleton, you have a small curve that goes in the lumbar, and the thoracic it goes out, and then neck, cervical it goes back in. And you want to try to maintain those three curves when we're doing activities under load. And obviously
Yeah.
some sports we will get out of that. We won't be in that position, but that's what we want to be training is how can I teach my body to maintain the normal curvatures while I move through the bigger joints that are supposed to be rotated and moved through the hips and the shoulders.
So I would love to stick on this for a moment because I think this is a really important part. You see a lot of times when people have, working with a new client or assessing a new client, you're going to look for like a good hip hinge pattern so you can limit with a dowel, right, the degree to which the head's flexing or extending and have those three contact points, back of the head, T-spine, and then your tailbone. And you can get people to move on that axis. Now, when someone deadlifts, I feel like the biggest thing that people reach for in the beginning is don't round your spine at all. They're like, don't round your spine at all. If the spine rounds at all, like the whole building is going to fall in and we're all going to die. And to some end, I understand where that criticism is coming from, because if you take an untrained individual and you load them, the likelihood that they do that properly and get good glute engagement and hamstring engagement and extend their hips is really low. It's much more likely that in trying to figure out this movement, they're going to pull because the object's on the floor and they want to get it
Mm-hmm.
up. And for whatever reason, we just think that to do that, we need to pull it up to us. And that's probably because any other time that we've done that in our life, it's been a light object, like maybe it's a small box or it's groceries or something like that. And you can get away with that and nothing bad happens. You load up a barbell with someone's body weight or a little bit less than, and they do that, it can be really problematic. But on the more experienced side of that spectrum, and you'll see this with high level Olympic weightlifters, definitely power lifters, or you'll see it with inexperienced weightlifters too, and it kind of all look the same. You'll actually you'll see the T-spine round the way that you were just talking about. Like if you look at the spine from a profile view, you get that natural curvature through there. And so when you load that, even with correct mechanics, to some degree that it pronounces even more. So can you touch on the safety level around that with variance to skill level and kind of criticisms about like rounding your back, keeping a flat back, scooping your lumbar out, because that can create other problems in and of itself, or just kind of your vision on hip hinging mechanics and spinal flexion?
Yeah. I love this topic, so I'm excited we're getting into it. If you look at like the high level, the weightlifters, when you're doing a heavy deadlift, and this could be competing or not competing, if you're getting the movement through the thoracic spine, we're okay with that because that's emphasizing going into more thoracic kyphosis. What we don't want to see is the lumbar spine flexing. So the lumbar spine reversing that curve. Okay. That puts the pressure through the disc. So we don't want to see that change. That's one piece of it. And the other piece of it is we don't want to see it change when it's under load. And so or you're moving load. So if I start in a neutral and then I pull and then it flexes, well, we're moving the joint while we're holding load, and that's going to put the stress through the tissue around the spine.
And so someone might say to that, they go, yeah, but look at someone who's setting a PR, you know, they got 600 pounds on the bar and they lift and their back moved. They must not know what they're doing. Right. So how do you approach that criticism?
Yeah, I think that's a simple, it's an understandable question, but it's a simple answer. Like they're competing, they're trying to either break a world record, an Olympic record. They're trying to do it at the highest level. They probably, I would guarantee all of them, understand the risk of the position that they're putting themselves in, and know, okay, I'm doing this, I'm putting my body at risk, and I'm doing it because I'm trying to achieve something bigger. I'm trying to win a gold medal, or I'm trying to set a PR or a world record. Do they train like that all the time? No, I guarantee it. They do not, because they understand the risk of what that does to the body. The same thing happens in every sport. I mean, you look at basketball, do they want to be in a position where their knee drops in and they tear their ACL? No. Do they understand the risk of the sport? that may happen. They may slip on the floor and it happens, or someone may run into them and injury occurs. So it's understanding the risk in the sport or the activity that you're doing.
So on this point, actually, I mean, we're very much in line with this. I think when you look at when you look at elite, anybody's doing anything, expect some variation in the baseline mechanics because they are breaking the mold of what's possible. I mean, even elite runners, right? You look at elite runners running the last quarter mile of the marathon in the Olympics don't look as pristine as a runner out for a 5K recovery run who's also an elite athlete, right? You're going to be breaking down those patterns, the ability, the physiology to achieve this insane moment of glory one time, maybe in your life. Right. So that can be put over here. When we look at a sport like jiu-jitsu, it's so weird. And, you know, you could also say this is true for a lot of combat sports, wrestling included. There's so much torque and so much force acting against you at all moments that you're doing the thing. Whereas something like, as impressive as Olympic weightlifting is, the bar is a fixed object and either the athlete can move it or the athlete cannot move it. And that's what makes the sport so beautiful. In something like jiu-jitsu, you can train a hip hinging deadlift pattern and load it up to, let's say you achieve 110% of your maximum through a training program. That's awesome. And then you're training and your partner goes to pass your guard and they fold your T-spine like this, and now your knees are up near your ears, and your lumbar, which has been trained in this pattern to be very stable, is getting rotated and extended at the same time. So when you look at the forced element, the fact that someone can act against a practitioner and put them into positions that they're not trying to get into, how do you adjust some of these recommended exercises to account for that unpredictable nature of the sport?
Yeah, I mean, it goes to the load and the intensity. Well, the load that we're doing it maybe in the gym. Uh,
Yeah.
we can work on the weird nuances and the weird positions of the sport safely in the gym, to help people become comfortable. Maybe someone can't get into that position because there's a mobility restriction. Now we work on the mobility restriction, they can achieve that position. So when they're forced into it in jiu-jitsu, yes, there's a demand of the external force, but we also aren't we're also not fighting against the restriction of the body because we've worked on that mobility. And so there's ways that we can work on those positions safely in the gym to prepare for that. At the same time, we're doing a combat sport against someone else. Every time you do it, it's different than other sports. Every time you do it, you have to understand there is a risk because someone else is forcing you into positions. But that's where
Right.
the training side of it can help decrease the risk some, not eliminate, decrease the risk by practicing the awkward positions, understanding what my body's doing when I'm in those weird positions, and maybe how to decrease your risk in those positions. And that's where, like, I think George does a fantastic job of that, and Casey does a fantastic job of that because they've worked so much with fighters to understand the demands that the sport has and how to teach people how to be comfortable in those positions and how to safely get out of those positions.
Yeah, if we look at the neck, let's just say that an individual sitting like I am at rest can do this and they can do that. But then you look at jujitsu, and a lot of times it's this
Right.
and that, and the person on top of them weighs more than them, and they're doing this twice a week for fun, right? To stay healthy, they love martial arts, they love jujitsu. When you look at that kind of initial limit in range of motion, right, or a limit in mobility, this you can expand this to the hip joint too because it does so many things. How do you want that person to start to approach their practice? Because you're not going to tell them don't do jujitsu until you have 90 degrees of rotation in your neck, because the reality is they may never invest the
Right.
time, because a lot of us are doing this as an extracurricular. People are juggling family and jobs and this, and you throw a prescription at them that takes 30 minutes a night, and the reality is they just drop the ball and they don't want to do it. So when you go, from a coach's perspective, you can look at it and you go, wow, there's 30 degrees of like almost guaranteed injury at some point in this sport. What do you tell that person to best prepare their body at a minimal internal or minimal initial effort, to where they can start to see that benefit them without having to overhaul everything that they're
Right.
doing?
Yeah, I think we'll stick with the neck. I think there's some easy things that you can do to work on that don't take a ton of time. I think number one is try your best to move the neck through all of the degrees of freedom in all of the ranges. So if you're here before you start, it will take 1 minute. Do a few reps of turning your head back and forth as far as you can, trying to slowly increase your rate, your range back and forth, up and down, and then your side bending. So you're working through all of the ranges to try to increase a little bit of that range before you go to practice. Um, that's one thing. Another thing is when you're in practice, if you feel like you might be in a vulnerable position, be okay with getting out of it. Be okay with tapping it and
Yeah.
stopping sooner instead of trying to be the guy that can't be beat and ends up being hurt. I mean,
Yeah.
that's something
I think,
you and I talked about extensively when
yeah.
you were returning, and I'd love to hear your perspective on it. Like, was that hard for you to do when you went back to limit yourself and understand? Okay, this is vulnerable right now. I'm going to stop, or how was
I
that?
think, I think with that, the hard part is if you've been training jujitsu for a long time, there's some part of your personality that loves that part of it. Like you're not still here because you love tapping early and just going, oh well, I was in a bad spot. There's this part of you that likes working out of the bad spot or not giving up and resisting and like just playing into that a little bit. Now, I think I recognized really early on in our conversation that my big question here was, can I train again or not? That's what I wanted to know. I'm like, is there a world where I return to the mats and I'm doing, I'm coaching kids class and I do warm-ups? Or is there a world where like I can return fully to this? And I really felt like I put the ball in your court to help guide that for two reasons. One, I believed in what you were doing and your expertise, but two, I needed to offload all those questions. Like I was putting myself into a dark spot thinking about this injury and what if and can I ever surf again? Because you're in cervical extension and like can I look when I'm paddling like I started to do that and I'm like this isn't healthy. I need to talk to somebody who knows what they're doing. And so we came up with this like, all right, we're 5 weeks. Basically, the first four, there's no jujitsu at all. We need to focus on this thing. You can go to practice and watch, which I did. So I love that part of it. But like right now, we're not loading barbells. We're not loading our T spine. It's like, and I've shared the correctives. Like it was bare bones, right? This is like, let's get you to be able to look to your left and look to your right again. Uh, but it had progressions. Like we knew at some point within a range, there was going to be this return to very low level flow rolling, which was important. And that we even recognize has this risk because if you flow roll with the wrong teammate, and I don't mean wrong like they're a jerk. I just mean if you choose to do that with someone who's not 100% in line with the fact that you're injured and you're trying to get better, it can be a disaster and it can ramp up really quick. So us having that discussion about being intentional with the training partners and flow rolling, really being flow rolling, very low intensity, like 2 to 3 out of 10. If something goes wrong, stop. And having that guidance from you was key. Like that was crucial because it got me to put the gi back on. It got me to get back on the mat. And it got me to feel like I was doing jujitsu. Having that moment at like 5 weeks was a huge point in belief that it was possible to get back to full-time training. And that's like, I really can't undersell or oversell how important that was. And so I did like mouth tape when I went back because I knew that that would force me to not train too hard doing the flow rolling. And we got to a place where like I just accepted that the way that I did jujitsu was going to be different forever, in that I was going to have a lot more intention with how I addressed my readiness to train on the day that I'm doing the training. Whereas before I felt like it was kind of a rolling cycle. Like I'm always, does this hurt or does that hurt? Am I good? Should I not train as hard in the gym today? Or should I do more strength training, whatever? Now it kind of always starts as like, I walk into the academy and I go 0 to 10, where are you at? And if it's like a 4, I approach training as a 4. But if I'm a 10, I approach it as a 10 and I fully let the guard down and I go for it. And all of this to say with the tapping, not tapping thing, I've just learned that like, if you're not at a 10 readiness, you can't hold yourself to a 10 tap. Like you can't degrade yourself because you uh, exited a bad position on a day when you felt like a 4. It's just not right. Like if you're a sprinter and you're recovering with an Achilles injury and you feel like a 4, maybe you shouldn't even train that day because like your sport is all plantar and dorsiflexion. So what are you even doing at a 4? Like anything below a 7, right? So I think that was the hardest part about returning to jiu-jitsu with a neck injury, coming off of a neck injury, is just accepting that there's variance to your intensity and ultimately it just comes down to ego. Are you good with that or not? And if you're not, you're going to have a really hard time getting back into the sport.
It's ego, and it's the ability to have that conversation with yourself. Like, am I okay
Yeah.
with analyzing how I feel and accepting the result of that, and not just saying, whatever, I'm still going to push hard, because things will happen, injury will happen. And so it's knowing yourself well enough to understand what your body is feeling like and how much to push or hold back on that day. And like you said, like if you're feeling 7, 8, 9, 10, like let's go, let's push. We're going to work hard.
Yeah.
And if we're below that, we're going to be smart, because we want to do this for longevity. This is not, oh, I have a world championship tomorrow. Yeah, I feel like a 4. Well, I gotta be ready to compete for this. Like there's times where you feel like a 4, but you have to go. It's different than when you want to do this for 10 more years, 20 more years, whatever it is. We have to be able to have that self conversation with ourselves.
Right. And that's, I mean, back to the very original part when this injury even occurred, before the randomness that put me in the hospital. I tweaked it on a takedown in the second round, or in the second bout of a 4-bout match in a tournament. So when that happened, in the moment I assessed it, it was like, how do you feel? 0. But you're in the middle of a tournament. So what are you going to do? Are you going to drop out, or are you going to stay in? I stayed in. So you make that decision, exactly as you said, scaled to what's actually going on in your life. Now, with all that being said, you and I happened to have a pretty like straight on, very agreed relationship. We understood each other's skill sets. I took everything you said very seriously. You had an awesome community around you with regards to jiu-jitsu. I was adamant about the prescription. We had conversations every week. This kind of was like a 5-star experience, and it couldn't have ended with a better outcome, right? That's not always the case. So when you're working with people and you give that prescription, you know, you've taken them in, you've done the assessment, you kind of see like, okay, you know, you still want to do another half Ironman, and that involves swimming, and your shoulder's in this state. How do we get you back to not being in pain when you're riding the bike because of the loading, being able to use your correct arm strides when you're running, and then being able to swim? And so you come up with prescription and you write it for them and you walk them through it, and you get to a check-in and it's partially done, or they don't like it, or some of the exercises hurt. How do you start to move that needle forward for these people and still keep in line, you know, their vision of getting back to the thing that they love, but juggling a little bit of this uncertainty in program adherence and exercise selection?
Yeah, I'm a big believer that it's not the client's problem or the patient's problem of why the program's not being adhered to. It's more the practitioner or the provider. Like it's more on me at that point. If someone came back and they're like, I didn't do my exercises, that's on me. I take that for something I messed up, because I maybe I didn't educate them enough to show the value of why we're doing that movement. Maybe I added too many exercises to their program. There's something, and I didn't understand their life stresses, their life outside of their own health that they have going on. So if someone comes in and they haven't adhered to the program, I need to understand why. And that's where it takes having a deeper conversation of, what was it that you didn't like about the program? Was it too long? Was it too short? Was it too boring, etc.? And then we need to make the adjustments. So number one, it's having that conversation. And then number two, if there still isn't adherence, I haven't done a good job of getting down to their why of why they want to get back to their activity. If you do that and you talk about that, people will do the program. Like I know people that are very busy running multiple businesses and they still do the program prescribed. It looks very different than someone else, but it's because we understand their why of what they want to get back to.
It's a humble but honest perspective on it. It's a challenge, I think, as anyone who's in a service business, to take ownership over when things aren't being done the way that you intend. because you're right. It is our job as the professional to expect the best, prepare the best, and then reassess when things aren't going that way. And it's very easy to just point the
Yeah.
finger. It really
Yeah.
is.
But I don't know. I mean, it's something I've thought for my entire career. I learned it from, it was something I picked up from one of my mentors early in my career of, you need to ask yourself why they didn't do the program, because it's on you. Or like it's on you as the provider, is what he was saying to me. And I'm like, okay, I get it. Like, I need to take
Yeah.
ownership of that. And it's something that I still believe today. Like, we as providers or coaches need to take ownership on that. If someone's not doing it, change it up. You need to figure out what they can do and how to get them to do it. That's why they're coming to you. If they didn't need to do
Totally.
it, they want to be seeing you.
Yeah, the start. I think who was that? Simon Sinek. The Start with Why. Is that? Have you ever
Yeah,
read
it's a
that
great
or
book.
been exposed to his stuff?
Mm-hmm.
But that whole idea, like when you really pin that thing, when it's that emotional trigger that's tied to whatever the thing is, for me it was very easy. I was really emotional about if I couldn't ever train jiu-jitsu again. It's like a devastating moment in my life. So it's like, here's the button, press
Yeah.
it. But it's not always that easy. Sometimes there's a couple layers of the onion that you have to peel back to get to that point where it's like, oh, I didn't know that you're running the 10K to raise awareness for this person in your family that's like suffering from this disease, and this is the only avenue with which you can support them. But now knowing that is like, hey, remember, we're doing this so that you can recover, so you can get back, so you can compete and raise money, and you can help your family member. It's like, oh, right, okay,
Yeah.
cool, get back on track, and have that forgiveness when things don't go perfectly, to have water under the bridge relationships with people and start anew all the
Yeah.
time. But it's tough to manage that.
It is tough, but it's exactly what he said. Like, maybe we need to remind them of that every once in a while, but also
Mhm.
be okay if people mess up and be like, all right, we're gonna get back to it, and we're doing this together. Yeah.
Yeah. Well, I want to talk about, there's one more thing, which is the facility itself. I'm a big fan of, and have been ever since, you know, before having casing on. But what you guys do at DBC, I think, is great. It from the layout and the aesthetics of the training facility to the staff and what you guys offer there. You did something unique, which I thought should have been done in the space a long time ago, which is paired directly by separation of a wall, a wellness recovery and PT studio with the actual strength and conditioning. So we see this in sport, of course. Any massive team with a ton of funding, it's going to be a symbiotic relationship between all the different levels of training and coaching and recovery. So it's, you kind of plug the athlete into it. They do all the things that they do, and wherever they need to go next or are recommended, you just walk through the next door and they take care of you, and because they want you back on the field. Not as common. You don't see 24-hour fitness pairing with like a well thought out and pragmatic recovery studio that actually has purposeful equipment in it for reasons, not just because they're market trends. So when you look at like the recovery studio at DBC is sick. You have the two cold plunges, the saunas, the private rooms for your work, and then the acupuncture, massage therapy, and then obviously the diagnosing and like testing side of it. When you guys were choosing pieces of equipment to put in there, right? There's so many different pieces of equipment in the fitness industry now that are marketed to you that you could choose. What is it about the things that you did choose to have in there that you recommend to clients that you see as really useful? And when do you lean to those examples being, when do you have a client utilize cold exposure? uh Part of that question is because there's like a little bit of a barrier to entry. You have to condition yourself mentally to be able to do something like that. To even be, not many tools have like a prerequisite of having to get yourself emotionally and mentally over a huge barrier to use it. But between that, the percussion therapy, the Normatec boots, why these pieces of equipment in a studio designed to help people get back into the gym next door?
Yeah. I mean, I think the modalities that we have been, there's been a lot of research lately, but also over the long term of the benefits of them. So that's why we chose a lot of them, and we didn't just want some gimmicky thing that's hot and popular right now. And so we have the cold plunges, the saunas, the compression boots, and different mobilization tools, etc., as long as with all the providers. But really to provide an opportunity for people to come and use recovery tools that you see at high level professional sports programs and organizations, as well as universities, etc., that you see the top athletes using, but no one ever gets to use them or have access to them because they're expensive to have on your own or at home. And so we wanted to provide that and give the general population and athletes a space to use that when they're not, for athletes when they're not at their school or professional organization, etc. So that's where it came from, and we wanted a place that feels like a high level operation, and it feels like you're at a top professional sports organization that you can come to every single day.
What do you see change in clients as they begin to incorporate specifically cold exposure and the plunging?
I've seen some really cool things. Some people have seen like a decrease in depressive symptoms or anxiety. I've seen people
Wow.
improve sleep. I've seen people improve like temperature regulation. And then the obvious one of just like feeling more recovered. Um, but also using it as a pre-workout and getting the body kind of woken up, if you will, and ready to
Yeah.
go to exercise.
So can you explain from a physiological point? I've heard this a lot, that like there was this change from using, I think, what traditionally people would use cold exposure for on a just blanket term to reduce inflammation. So you'd see it post sport, athletes come off the field, they get in the ice tank, a little bit of soft tissue work, and they're on their way. In my head, I go, okay, if you put a person up to their neck in really cold water, you're going to constrict all the blood towards the center of the body. So it's going to pull it out of the limbs. And then you're going to decrease the core temperature. You're probably, I don't think I ever wore my heart rate monitor in there because it fogged my watch the one time I tried, but you're going to drop your heart rate down pretty significantly. And then you're going to go into activity, which from my understanding seems counterintuitive, in that you would want to increase circulation, increase core body temperature, slightly elevate the heart rate, go through dynamic patterns, and then load whatever you're going to load for the training session. So is there risk from a physical therapist view? Is that increasing the risk in anything
So
for someone who's going from cold into
into
activity?
exercise.
Or what's that? Yeah,
Yeah.
yeah.
So the duration of in the cold plunge will be shorter typically.
Mm-hmm.
And then, I mean, you can talk to it, not just me, but like when you first go into the cold plunge, what does it do? It takes your breath away and it forces you to find your breathing, and
Oh, yeah.
it you feel energized after. And it's actually um, it's increasing the sympathetic drive because now you have this crazy shock to the system, and so you get that spike in sympathetic nervous system activity, which that's what is the pre-workout that's going to carry you over to your warm-up or to your workout or your training session. So you may you still have to do all your normal warm-up and
Yeah.
etc. To get the body ready to train, and it may be longer actually, but it's a great way to increase that sympathetic drive before exercise.
So I guess the key there is duration. So you're dropping the duration down significantly to get, the other thing I like about that actually, and this is a hard thing to do, especially when you're dealing with like a higher income bracket for clients, like people that are, well, very successful in their own regard, is getting them to disconnect from work and life to do their training session. It's always a challenge. Like, we would do, sometimes diaphragmatic breathing patterns, whatever, to get them to just create this separation from life before they actually start the activity. Try to be stressed out about your next meeting when you sit in the
Yeah,
cold plunge.
yeah.
good luck. Like try to just, whatever is bothering you, really sit on that when you jump in that thing, because you're going to forget about it
Right.
instantaneously, and be hit with all these hormones that actually make you feel
Yeah.
awesome. And so I hadn't thought about that till now, but maybe there's some kind of benefit of centering your client to what you're about to do. Like, hey, we're here. We're literally shocking
Yeah.
you out of all the BS that's going on in your life and the meetings that you're missing and whatever. And now we're going to do this because it's for you and you want to be here. So let's really sit here. I think I like that a
Yeah.
lot.
That's exactly it. It forces you to be focused. You can't think about something else when you're in 39, 40-degree water. Like you better just be thinking about your breathing. Otherwise you won't make your time. So,
Well, if people have a sadistic side to them and they want to explore this area or see Drew, you guys can check out the show notes. There'll be plenty of links to Drew, to DBC, to go get actual really high level professional athlete level guidance on injury rehab, prehab, strength and conditioning, all that stuff. So Drew, it's been obviously time that flew by at an hour and a half. Really feels like 5 minutes, but it's always fun to nerd out with another person who like thinks about this stuff constantly. So
yeah.
I really appreciate you, one, for helping me out, man. I mean, I can't thank you enough. The guidance and the peace of mind and everything to be able to work through the scariest injury I've ever, knock on wood, sustained in my life. To be at a place now where I'm pain free, I'm fully in the sport as much as I ever want to be, and I have all the other things back in my life, and that's largely due to the assessment, the care, and then the prescription that evolved, through your guidance to get me back on the mat. So I thank you very, very much, man.
Yeah. Well, I appreciate you as well. And just, I mean, like you said earlier, you were a great client. You did what you were supposed to and stuck with me and believed and trusted. And that's all I can ask for. It was fun working together and fun to do this podcast together and just talk shop. I love it.
Absolutely, man. Thank you,
All
Drew.
right. Thanks, Abe.
Hey friends, Abe here. Thank you so much for tuning into this episode and sticking around to the very end. If you want to support it, leave a 5-star review on Spotify or check out www.maynideapodcast.com, join the mailing list, and stay up to date on all things The Mayn Idea, from future guests, sponsorship opportunities, products that I'm using to help me perform at my best, invites to ask me anything, and any upcoming pertinent information to the show. I cannot do this show without you. It is literally why I show up each week and put these episodes together. So thank you from the bottom of my heart from being part of the community. I hope you have a great day.